Hemophilia is a rare disorder. It affects the blood's ability to clot. This means people with hemophilia bleed for a longer time than usual. Even minor injuries can pose a risk. Understanding this condition is vital. It helps us provide the best care for those affected. It also highlights the importance of research for better treatments. This essay will delve into the complexities of hemophilia. We will explore its causes, symptoms, diagnosis, and treatment. Let's start by understanding the crucial process of blood clotting and how hemophilia disrupts it. Our bodies have an amazing mechanism to stop bleeding. When a blood vessel is injured, platelets, which are tiny blood cells, rush to the site. They clump together, forming a plug. Then, clotting factors come into play. These are proteins in the blood. They work together in a chain reaction to form a clot. The clot acts like a net, trapping more platelets and cells. This seals the injury and stops bleeding. Hemophilia disrupts this process. People with hemophilia lack or have low levels of certain clotting factors. This makes it difficult for their blood to clot properly. As a result, they bleed longer, even from minor cuts or scrapes. Hemophilia is a genetic disorder. This means it's passed down through families through genes. Genes are like blueprints that determine our traits. Hemophilia is linked to the X chromosome. Females have 2 X chromosomes, while males have 1 X and 1 Y chromosome. The genes for clotting factors are located on the X chromosome. If a mother carries the hemophilia gene on one of her X chromosomes, there's a 50% chance her son will inherit it and have hemophilia. A daughter has a 50% chance of becoming a carrier. The severity of hemophilia varies. Some people experience mild bleeding. Others have severe bleeding even without an apparent injury. Common symptoms include easy bruising, or even a slight bump can cause a large bruise, prolonged bleeding from cuts, nosebleeds, and bleeding gums, joint pain and swelling due to internal bleeding into joints, and blood in urine or stool, indicating internal bleeding. These symptoms can significantly impact daily life. Simple activities like playing sports or brushing teeth can become risky. Early diagnosis is crucial for managing symptoms and preventing complications. Section 5. Diagnosing hemophilia tests and procedures. Diagnosing hemophilia involves a combination of medical history, physical examination, and blood tests. Doctors ask about family history of bleeding disorders and the patient's bleeding patterns. They also check for signs like easy bruising, joint swelling, and prolonged bleeding. Blood tests measure clotting time and the levels of specific clotting factors in the blood. These tests help determine the type and severity of hemophilia. This information is vital for tailoring an effective treatment plan. Section 6. A historical journey. Hemophilia treatment through the ages. For centuries, hemophilia was a mysterious and often deadly disease. Early treatments were ineffective and sometimes dangerous. In the 1940s, a breakthrough came with the discovery of clotting factors. This led to the development of factor replacement therapy. This treatment involves injecting concentrated clotting factors into the bloodstream. Factor replacement therapy revolutionized hemophilia treatment. It enabled people with hemophilia to live longer, healthier lives. Section 7. Modern management of hemophilia therapies offering hope. Today, hemophilia treatment has advanced significantly. Factor replacement therapy remains the cornerstone of treatment. Patients can self-administer factor concentrates at home, either on a regular schedule, known as prophylaxis, or as needed. New treatments are emerging, including extended half-life concentrates, which last longer in the body, reducing the frequency of injections. Non-factor therapies. These medications work differently than factor concentrates, providing alternative treatment options. And gene therapy, this cutting-edge approach aims to correct the underlying genetic defect. These advancements offer hope for a future where hemophilia is a manageable condition with minimal impact on daily life. Section 8. Advancements on the horizon. Research and new discoveries. Research on hemophilia continues at a rapid pace. Scientists are working to develop even safer and more effective treatments, including gene therapies that could potentially cure hemophilia. They are also striving to improve diagnostic tools, because earlier and more accurate diagnosis can lead to better outcomes. And they aim to understand the genetic complexities of hemophilia, which can help develop personalized treatments. These advancements hold immense promise for the future of hemophilia care. Section 9. Raising awareness, inspiring hope, the future for hemophilia patients. Hemophilia is a complex and challenging condition, but with increased awareness, early diagnosis, and advancements in treatment, people with hemophilia can lead fulfilling lives. By supporting research and increasing awareness, we can empower patients and their families. Together, we can strive for a future where hemophilia is no longer a life-limiting disorder.